Behavioral Health Today, a podcast by Tried Behavioral Health, covering trending topics in behavioral and mental health. This podcast is designed to share unique and relevant topics occurring within the world and our communities and bring them a mental health perspective.
Welcome to Behavioral Health Today. I'm your host, Dr. Graham Taylor, and today I'm joined by Dr. Ann Callahan. Ann is Associate Professor in the Social Work Program at Eastern Kentucky University. She has a license in clinical social work and over 20 years of social work-related experience. Ann's research focuses on advancing hospice, palliative, and long-term care through spiritually sensitive social work. This has resulted in numerous presentations and publications, including the book Spirituality and Hospice Social Work. She is also an esteemed advisor to Social Work Today magazine. I am very excited to have Ann with us today as we talk about spiritually sensitive social work. Ann, welcome to the show.
Thank you, Graham.
So nice to have you here. You know, as we start out today, let's put a cornerstone in place as we begin. When we look up the definition for spirituality, we get the quality of being concerned with the human spirit or soul. In your work, how do you define spirituality within the context of the people you work with?
So the quality, and going back to your original definition, the quality of the human spirit or soul. So a lot of what we do in addressing mental health issues in social work practice is to connect with people. I mean, that's the vehicle through which we help.
Yeah.
And obviously, if we're thinking about people as having a soul, a spirit, an inherent worth, dignity, we want to connect with that in some way.
Great.
Because it's in that process of connecting that we can help people get past whatever it is they're struggling with.
You bet.
So to me, that's the essence of spirituality. Any kind of work we engage spirituality is we're tapping into the inherent dignity and worth of a person. Whether you call that spirit, soul, it's all relative to your particular worldview. But connection, for me, is part of that spiritual experience. Part of that spiritual journey, really, is reaching a connection with someone, reaching that depth with someone.
So spirituality in this context is about helping folks create and experience meaningful, sustained, and it sounds like you're saying life-enhancing interactions with one another as within the therapeutic relationship when there's that opportunity to do so there too.
Absolutely. So at least for me as a social worker, that's where it starts. Working with my client, my first exposure to that client is that therapeutic relationship. So I want to do everything I can to engage that client in a way that is meaningful, to where I am addressing their concerns, specifically the reason why they're there, the reason why they need help, the reason why they're in this world ultimately, and the work that we're doing together, just connecting with them on what matters to them most and figuring out ways to address their concerns so that they have continued increased quality of life. I mean, ultimately, palliative care has been so formative to my work experience and the research that I've done. It all stems from concern about quality of life and what can we do as professionals to enhance a client's quality of life.
It's really good. So as you're talking about beginning that new relationship with someone, those are some examples of what you're trying to help them cultivate in their life. You're talking about making connections with others and making it life enhancing.
My practice primarily began in mental health care. So when I'm talking about spirituality and how do you draw spirituality into the work that you're doing, I'm referencing my experience as a mental health practitioner, thinking about my work in working in a hospital setting. I'm thinking about my work working in long-term care. And then I'm also thinking about the literature. I've looked at lots and lots of literature on how do you engage in care in a hospice setting, social work particularly, how do you engage in social work practice in nursing homes. So I'm drawing from the literature, I'm thinking about best practices in terms of what is evidence-based to engage folks, to inform my practice primarily in a nursing home setting. And so a lot of the work in long-term care entailed working with individuals that were struggling with adapting to their new home environment and dealing with relationships that they have with other residents. I mean, you're all of a sudden living with people. I mean, you're sharing a room. Yes. I mean, can you imagine sharing a room with some stranger? I mean, and then you're struggling. You have a chronic illness. So you're dealing with this chronic illness, and you're having to deal with a neighbor, in your room. You perceive it as your room. You have this intruder. Yes. So you're talking about just naturally it would be hard to adapt. But then on top of that, you've got physical conditions, chronic illness, disability, you have emotional health issues that could be pre-existing. So when I'm thinking about spirituality, I'm thinking about how can I do my work in a way that is compassionate
Yes.
toward these individuals that are struggling with adapting to this environment, this strange environment. What can I do to help these folks feel most comfortable in this space? Could be a space that they're in. They didn't choose it. It was chosen for them
That's right.
because they were in the hospital. They couldn't be discharged home. Family members, they don't have the capacity to care for them.
It's such a hard thing, isn't it? When someone's discharged, they don't have maybe as much control or choice over their life. Their agency is kind of taken away, whether it be their inability to care for themselves or maybe the disease process or illness process they're dealing with. But as you're laying this out, what strikes me is that not only is there a transition that is often seen as maybe someone's last stop. That's a very hard thing for some to maybe even contemplate, whether it is or not. Sometimes that's a natural thought. It's just going to be my last place that I live. But then you're talking about this myriad of other considerations, roommates and protocols and just the whole adjustment process, not having recognized and familiar people around you. That is quite a set of things to assess, isn't it? You're talking about a very holistic assessment of taking into consideration all the various needs that they might have. And then it sounds like with the spiritual focus, really looking for ways that they can plug them in, again, in very meaningful ways while they're in the facility that they're in. Pretty significant.
Yes, absolutely. That is the great description of what it is I'm talking about. How I, as a professional, that is inherent to how I engage with my clients. When they're vulnerable, when they're stressed out, they're scared, they're in a new space, how can I be compassionate? How can I be most sensitive to their needs to be treated as a person with dignity? And to me, that's spirituality. That's the expression of spirituality. That's being sensitive to the spirituality, the innate value of the client that I'm working with. And clients, they don't necessarily recognize themselves always as spiritual. They don't necessarily view themselves as having a soul, perhaps. But it's really in how I approach them and the terminology that I use. I may not be saying, well, what religion are you? Or, well, tell me about your spirituality. They may not even really conceptualize it that way. But I would probably say more like, well, tell me more about what gives you meaning. What's important to you? What gives your life quality? So we'll focus in on those types of things. Generally, most of the time, I'm not going to be going in there and talking about religion per se. It's about building quality relationship with my clients and helping them build those quality relationships with other people to help ameliorate isolation, the risk for isolation. And also think about themselves, rebuilding that relationship, if you will, with themselves and thinking about, well, who am I now that I'm in this nursing home? Or who am I now that I can't care for my spouse at home who needs me? Who am I now that I can't be with my dog, my favorite pet?
Right.
I mean, so a lot of significant internal work goes on as they're processing this new life that they have. They're thinking about what makes them whole now that they have some type of a disability or chronic illness that is life limiting. Perhaps they have a sense of having a terminal illness in a nursing home setting that would not be uncommon. You would have hospice care perhaps coming in to provide that assistance. So I would be supplementing that care of other providers. We'd be coordinating our work together to ensure this client, this resident, has the best quality of life.
What I love about that and what strikes me so beautifully is that all of that exploration and all that meaning and all that discovery for themselves around what their needs may be and the adjustment process, et cetera, all starts within you coming into relationship with them, doesn't it?
Absolutely.
And just coming alongside them and just in a very gentle way. How are you doing? There's a lot on your plate.
Absolutely.
How many transitions have you counted that you've had to go through today?
Yes.
And what have those been like? And what is meaningful to you? And what are your losses around right now? Just help me understand things right now, the way that you're experiencing them, and coming alongside, just kind of holding those as they begin to kind of sort through them and begin to be clear about what those areas are. And then I would imagine, like you're suggesting, that we can start tackling some of those.
Absolutely. So really what you're suggesting, which is very true, is you're figuring out ways to connect with clients, to talk about some of the internal struggles, some of the fears, anxieties. You're creating that safe space through building relationship. I had this client, I was walking down the hall and she comes out and someone says, so who is that? And And this other client whom I had been working with, she comes up to me and she grabs my arm and we're walking down the hall. She says, "This is my listening friend." And so,
That's
even if
perfect.
something as
Yes.
simple as, "This is
Yeah.
my listening friend," she has an
Yeah.
idea of who I am. Her role in her life is to be just a sounding board, if
Yeah.
nothing else. So when it comes to building relationship and relationships that add meaning to life, to me, that's what spirituality is.
It's where you kind of had us at the beginning, this definition where it's about that human spirit and that soul and wherever that person is in their life, and just being curious and interested and non-judgmental around who they are and what's going on, and just kind of joining them in that. I know that there are, as we all know as practitioners, a variety of very useful theoretical approaches. In your focus with hospice and palliative care and kind of long-term care, what theoretical approaches do you find being very useful as you come alongside the patients you're describing?
Well, really, the sky's the limit.
Yeah.
A lot of what I do and a lot of what social workers do, generally speaking, entails more of an eclectic approach. In psychology, there's lots of theories that you can draw from to intervene with clients relative to what their strengths and weaknesses are,
Yeah.
relative to what your areas of expertise are. Social work, we draw from the strengths perspective. We look at what
Yes.
it means of resilience does this client have. Spirituality can be one. It can be one that we can tap into and enhance through being intentional about building
Yes.
relationships that add meaning to life. That's kind of what we're
Yes.
talking about. Ecological systems. How are they embedded in their environment? What kind of systems, what kind of relationships around them add quality to life or a stressor? For example, I was working with a client one time, just talking about things going on, relationships, and I kept noticing that the door by her room was slamming shut. And every time it slammed, she jumped. And I'm telling you, this door slammed multiple times just in that span of 30 minutes. And so that was an issue. She couldn't really articulate to me that that was a stressor for her, and that was decreasing her quality of life. But that was part of that, recognizing an environmental factor that needed to be addressed to enhance her daily life. But in working with her, I was able to recognize that. She couldn't articulate it necessarily, but through my observing her reaction to it, I was able to problem solve and say, how often are you using that door? Is it necessary? Can you reroute and kind of go out the front door? So we were able to work together around that issue, and let's say example of problem solving, but also looking at other systems related to the larger environment.
As practical as that sounds, it's essential. You're talking about the theoretical approaches, and we can, name a number of them that would come into play here. The sky's the limit, like you said, I would agree. But I love that strengths-based piece. In fact, a lot of times people don't know what they don't know about areas of their lives that they're kind of doing pretty well. And some of those areas that are really going well, we can emphasize those, can't we? Maybe it's some of those
Absolutely.
areas that maybe they haven't seen, being able to kind of bump up a wee bit. But as we talk about them, I'm noticing that you are very acutely aware, whether it's a door banging or maybe just some relationship things that you hear or aspects of their life that you really kind of probably hold up and say, man, you really do that well, don't you? Or that person really shows up. What is it about that relationship that you guys do so well? And sometimes we don't even think about those things, but we can take those and, again, like you're suggesting, enhance that to make what's good better and better best, to really, like you're saying, increase the quality and the meaning of the relationship that they are in their environment that they're trying to, live successfully within.
Absolutely. Well, and then that gets back to relationships with other people. You can talk about theories, being person-centered and focusing on the worth of that individual. Being still an adult, yes, they still have choices they can make. What would you like to wear today? Would you like to brush your teeth? You don't even have any idea how dehumanizing it can be in a nursing home. But it's that constant reminder of who we're talking to. It's that they're a person that is worthy of trust and dignity and respect. I was working with a client one day, and this is my first time meeting him, and he was in a nursing home. I was going in there to do an assessment with him, and he had a very dark room by himself in this room, almost looked like he was covered in a shroud. He has his blanket pulled way up to his neck, and I was leaning down to talk with him, and I couldn't hear him very well, and getting ready to work with him, and he just was like really struggling to talk with me, and I couldn't understand him, and finally he blurted out with really anger, and he says, "I was a doctor." And it really struck me, because when he said that, it made me realize that he had felt demeaned by his environment. He had gone from being in a very prestigious position, most likely as a doctor, to being a resident in a nursing home, laying in this
Yes.
bed. It was really interesting and powerful to me for him to make such a point that he had been a doctor, that's all he could push out to say to me. So it's
But
really
it
made me
sounds like in
turn.
that moment, what you did so beautifully was you connected with all that must be meaning for this man right now while he's laying in the bed under the covers in the facility that he was in. And I would imagine just from that one headline, you had this story that began to form of what this might be like, and probably set up a number of questions for you to pursue with this guy, probably in some very, very meaningful ways that others may not know how to pursue and to really assess with and for him.
Just the awareness of the importance of personhood,
Yeah.
which is ultimately really what we're getting back to, the whole idea of spirituality and building those relationships that are sensitive to
Really
the
good.
inherent worth of a person.
Agreed. Agreed. It sounds like your assessment process is not just always of the person you're working with, the client or the patient. It sounds like you get to assess different areas and then, likely consult with those that are going to be engaged with and relating with the person, whether it's a staff at the hospital or whether it's, family members. And I love the idea of creating those that are interacting with the patient, creating value and worth and dignity, and honoring them in that, even in the stage that they're in right now, which is often very hard, and you feel like you're losing, your faculties and your freedoms and everything else goes along with it. What we can have is our dignity and the respect that I love that you're bringing into this in your assessment process. And clearly you are adept and very, very aware of the subtle and not so subtle and overt things that are all part of an assessment process. But I also know that you've talked about how they're, in terms of spiritually focused, there are some spiritual assessment tools that can be brought into the initial screening process as well. Give me a sense of one of those, would you?
Absolutely, Graham. There are lots of assessment tools for spirituality, existential type broad questions that you could ask clients to assess how they're doing. It's all relative to their level of insight, their cognitive capacity to really articulate, what lends strength and hope to their daily lives. What's their philosophy of life? How do they make sense out of this thing that is happening to them now that they have this illness, or now that they've moved into this nursing home? How do you make sense out of this change in your life? What gives you the desire and the motivation to go on with life? What keeps you going day to day, as you're struggling despite the challenges? How do you keep your spirits up? It's just obvious questions you would want to ask somebody, can lead a lot of insight into what fills them up.
Yeah.
What keeps them going? And what can I do to build that? Continue to help them grow that, to sustain them as things change, as things get more challenging. It doesn't take a long time to accomplish something that you really needed to do a long time ago when you're facing the end of life. Maybe, seeking forgiveness for something weighing heavy on you, and you finally can have that opportunity when you have a social worker or another mental health professional there to help shepherd you through. So it just takes awareness and in the constant conversation. It's that is an ongoing assessment process. That it's a long conversation.
These questions, as you're even talking about them, I see them being so easily woven into a relationship dynamic, just a conversation.
It is.
And as I'm listening about that, I'm also thinking about accreditation commissions, which are always adding relevant aspects to their review process. And I know that they've added to a client's assessment the spirituality aspect of this as well. And it sounds like a lot of the questions that you were just describing in the assessment process of just getting to know someone within their context, kind of as I mentioned before, kind of almost like a phenomenological approach to understanding the person in their entirety. It sounds like some of those questions are also likely part of the accreditation committee's, list of things that they were going to be checking off to make sure that they're covered in the person's assessment.
Yes, Graham, what you're talking about has to do with that joint commission.
Yes.
Joint commission does require an assessment of spiritual needs and beliefs and values and preferences and all that. That is required. And who does that it's not necessarily me as a social worker. It could be a nurse, but it could be any one of us contributing to that process of assessment. And all of that is housed in the client's assessment chart that we're adding to daily as we're encountering our client. But I'm not necessarily talking about always doing what is required for that joint commission, I'm just talking about on a daily basis, building relationship and
Right.
in the process of providing care. It's really a framework and it's a perspective. You're walking
That's right.
into this relationship with someone. It's not a tick on the box. It's also a framework. It's also a perspective through which we approach every encounter we have with our clients. It's a perspective that we employ and use to understand what's going on in our environment with our clients. You talk about theories, person and environment. It's just the ecological perspective. How does this person fit in their environment? And spirituality adds to the liveliness of that environment. It adds to the strength and the wholeness of that environment. And maybe that environment is as micro as a person's body. When you talk about another theory, biopsychosocial spiritual, different kinds of aspects of a whole person. So on a micro level, if a person isn't getting their spiritual needs met, it could come out in physical consequences. It could come out in being a mental health consequence, depressed, feeling hopeless, lack of ability to have any sense of purpose and meaning, and feeling like life isn't worth living. And, we're talking about biopsychosocial, some social withdrawal, so there's going to be some spillover in other areas of a person's ability to function. So, getting back to that, how do you, working with clients, it's an ongoing assessment. It's a long conversation. And that assessment, ongoing assessment, that long conversation also manifests as different types of interventions. We're drawing all kinds of theories, eclectic combination of theories to engage in those interventions, depending on the client's level of competence. I mean, if a person has dementia, you're going to have different techniques. You're going to probably be a little bit more heavy-handed in terms of intervening and being directive than a person that is in a nursing home because they're there for rehab. I work with plenty of people that were there just for rehab. And so they were they had a traumatic accident, and so we're processing how they survived this death-defying act. Yeah, they had a lot of physical rehab to do, but they're here today to talk about it, and so they were dealing with that. That's a different. It's like realization of, oh my gosh, what has my life meant so far? What am I going to do now? Because I have a new perspective on life. I have a whole nother chance to go back out and accomplish what I want to accomplish. I was frittering away my time before. And so, so that post-traumatic growth opportunity after an incident that you can assist them through, or at least initiate that process, because in rehab, they're not going to be there for very long. You only have, just several months at the most.
What I really like about that is that there are times when we do have to help folks kind of work through the Kubler-Ross's stages of death and dying. And although they may not be dying, they're having to mourn and grieve some aspect of their life that might be related to, limited capacity or the trauma that they went through. But I love the part of once we, go through the bargaining and the anger, depression, acceptance, there's a place where we can move into transcendence, where we get to kind of grow out of and into something that can be, I'm going to go back to what you're saying earlier, life enhancing. Whether it's, using spirituality to kind of stitch together aspects of their lives that they haven't done before, maybe never even thought of before, but this gets to come into play. So really looking to help them grow despite what they're in, whether it's a nursing facility, whether it's a rehab facility, an adjustment to their illness, life can still be very, very fulfilling.
Absolutely.
Just in one quick minute, tell me a little bit about the FICA. This is a test. If someone wants to use kind of an assessment tool for, let's say, an initial screening, in addition to all that you're laying out can be asked in the assessment process, Buchowski and their colleagues came up with a FICA. Give me a 1-minute drill on how this can be incorporated and just a quick overview of that assessment screening tool.
Sure. So when you're working with a client, you're going to be wanting to do a biopsychosocial spiritual assessment, most likely. And the spiritual component may entail some type of faith or belief system that gives that person a sense of meaning, a way of structuring their life, their daily life, a sense of purpose. And also you want to know, absolutely, is spirituality an important component of their treatment or their lives? If it's an important component of a person's life, then it should be a part of their treatment as well. It will have implications for the client's treatment. So we'd want to know how spirituality has influenced them. And community, wanting to know what type of people are around you that provide you the support that you need. And that gives you more ideas about who to tap into for follow-up, to support care when they return back home. Also addressing in care, does that client even want you to talk about or address spirituality or religion? And that's where you can really start getting to the heart of the matter. Is this relevant for our treatment? How would you like for me to address this issue, spirituality or religion, with you? And a lot of times social workers are going to refer out, particularly if there are religious concerns. A person may even be referred to their own minister, pastor, their own religious or spiritual leader, drawing from that community as a resource to help individuals process some of these concerns that they're having. And so the FICA can be used really it's anytime.
Really
You might
good.
want to use the FICA when there's a change in a person's physical status, if there's a decline. You might want to just kind of touch base back on that and verify, has anything changed here
Very good.
with your thinking about these things? Because there could be some new relevance to addressing spirituality if there's some decline, if there's particularly if it seems as though life is near end.
Yeah, good. We're kind of winding down here today. I want to try and squeeze in two more things if you'd allow me. We have a number of practitioners that listen to our podcast here, and I'd love it if you could speak to your colleagues, our colleagues that are listening in today, and to share with them how they might incorporate and maybe even kind of do their own little assessment about how they're incorporating spirituality into their own self-care as practitioners. Any suggestions?
Self-care is huge. I'm afraid that it's taken for granted. If nothing else, self-care necessitates taking time out,
Yeah.
getting away from technology. Don't even turn your computer on. Don't even look at the phone. Don't even look at your email. Don't take phone calls. I mean, that time that you take and carve out for yourself has to be sacred. And there's been opportunities that I've had to learn about self-care the hard way. One of those opportunities was when I was working in crisis care, crisis intervention. And there have been moments where you're just waiting for that phone call, and you're out on the road going to see someone that is either attempted suicide or is threatening to harm other people. You're out there with the police and in emergency rooms and lots of intense situations. And so in those cases, and when you're in those intense type of jobs, how can you take a moment just to breathe deeply? At least I would use visualization. I would take deep breaths and I would hold my hands open.
Yes.
If not hold my hands open, I would use visualization and visualize a shower of golden rays upon me. Just renewal, just deep breathing, visualizing energy, whatever it is that gives you that sense of peace. And it doesn't have to take that long. Just taking that moment out, deep breathing and visualization. Yes.
Yeah, I really like those. That's kind of keeping our tank filled, isn't it?
Mm-hmm.
Making sure
Absolutely.
that when we're coming in to work with folks, we are topped off and they get our very best. The idea of kind of being this martyr that, goes and works and works and works and to the point of being drained, that we don't do anybody any good when we're empty. Well, and I love the idea of that self-care.
Yes. Graham, let me add that really this whole conversation today, the whole reason I'm doing this work is because I need meaning. I need a purpose. And my purpose early on, I've always felt, how can I serve the world? How can I help other people to the best of my ability? How I gain meaning, a sense of purpose by being of service to others.
Yes.
And so that in and of itself can be a means of renewal by having a meaningful job, recognizing that you are making a difference and staying focused on that, building those micro minutes of meaningful connections, those meaningful connections that remind you that, oh, this is worth it. Look at the smile on that person's face, or, oh, you're laughing, you're having fun. I mean, so finding ways to have those meaningful relationships with your colleagues, with your clients. I mean, it works both ways. Your clients might be, we're focusing so much on our clients having experience of meaningful relationships to add to life quality. We need that too. So, I mean, obviously our relationship with our clients is not about serving our own needs, but you can get your needs met as well in a healthy way. Connecting with someone, that feels good. I like that. I get a charge from that. And I'm an introvert, so you don't even have to be an extrovert to be able to get something out of those connections with people. You can get that renewal. And it's amazing how you might feel completely depleted and just a moment of reprieve, and you can have complete renewal and have really abounding energy and have no idea where that came from. So,
really
our bodies are incredibly resilient. It's just amazing. But being intentional and seeking that out. And it's okay to have needs for that. And build, seek that out in your relationships.
Yeah, that's all about the self-care piece as well. But Before we close, I'd love if you could share with us your website, because I know it's got a lot of great and very specific information on hospice, palliative care, long-term care. Let our listeners know.
Sure. Just look up Dr. Ann Callahan, DrAnnCallahan.info, and you will find me online. And I'll continue to upload links and materials. That's part of my service to humanity, really.
Yeah, that's part of your purpose and meaning. You are not hard to find, and you are very well researched. And it was a lot of fun to take a look at the things you're doing. You know, I know that those who are mentally and emotionally healthy create and have created and are able to experience meaningful and sustained, and like you're talking about today, life-enhancing interactions with one another. And some are even benefiting from being able to have a spiritually sensitive therapeutic relationship like the one you're talking about being able to have when you come into relationship with them. I know that one of your favorite quotes is from Anne Frank. How wonderful it is that nobody need wait a single moment before starting to improve the world. And it's easy to see, Anne, that you're doing this clearly in the lives of those you're working with. Love your work, and thank you so much for sharing what you're doing with us.
Wow, thank you so much for having me today, Graham. I've really enjoyed the conversation.
It's really been nice. And to those that are listening in, thank you for being with us as always, and we'll look forward to having you back with us next time on Behavioral Health Today.